You go to bed after a healthy dinner, feeling proud of your choices. But by morning, your brain may be at risk. No chest pain, no warning, just a slurred word, a weak arm, or a dizzy spell that seems to come from nowhere. And here's the shocker. It isn't fried food, it can be a vegetable. For decades, we've been told these foods are the safest on the plate. Yet after 60, our kidneys, blood vessels, and hormones change. What helped at 40 can quietly backfire at 70 when timing, hydration, and medications collide. Studies in the American Journal of Clinical Nutrition and the British Journal of Nutrition show that steady portions, especially for vitamin K greens on blood thinners, smart meal timing, and hydration shape circulation, while work summarized in stroke, AHA, links nighttime glucose swings and dehydration to vascular strain. Evelyn, 72, loved big late-night salads while on a diuretic. We moved her greens to lunch and added a small evening water. Within a week, the morning wobble eased and her energy returned. Mr. Harris, 78, snacked on raw carrots at 9 p.m. Shifting them to lunch with hummus and a boiled egg flattened his sugar dips and ended the dawn headaches. So the goal isn't to avoid vegetables, it's to use them wisely. Favor daytime for diuretic or fast-carb veggies, keep vitamin K intake consistent if you're on blood thinners, and add just enough evening hydration to keep blood flowing smoothly through the night. Before we fix the problem, let's name it. Which vegetables, why they backfire after 60, and the safer way to keep them on your plate. Number 1. Spinach. Spinach is a champion, but after 60, it can be a two-faced friend. It's rich in nutrients, yet also in oxalates that can bind with calcium, especially if you take calcium vitamin D at night, potentially nudging vascular calcification over time. Reviews in the American Journal of Clinical Nutrition and the British Journal of Nutrition discuss oxalate handling and age-related kidney changes that make this more relevant in older adults. A simple fix helps. Enjoy spinach at breakfast or lunch, keep portions moderate, and separate it from calcium supplements. If you have kidney or heart issues, confirm the plan with your clinician. Harold, 76, ate a nightly spinach salad with a calcium pill for bones. Mornings got foggier, blood pressure more jumpy. We moved spinach to lunch, shifted calcium to bedtime on non-spinach days, and trimmed portions. Within 2 weeks, he reported steadier energy and clearer mornings, without giving up the greens he loves. Number 2, asparagus. The elegant spear can quietly drain your circulation after 60. As a natural diuretic, asparagus nudges fluid out. In older adults with slower kidneys and weaker thirst cues, that late evening flush can shrink blood volume, thicken blood, and stress fragile vessels, especially alongside diuretics or BP meds. Reviews in the British Journal of Nutrition and the American Journal of Clinical Nutrition describe age-related hydration changes and hemoconcentration, while summaries in stroke link nocturnal dehydration to morning events. Practical fix. Enjoy asparagus at breakfast or lunch, sip a small glass of water with the meal, and pair with hydrating sides: cucumber, citrus, broth-based soup. If you're on a diuretic, ask your clinician whether timing needs an adjustment. Watch for morning dry mouth, dizziness, or brain fog. Calvin, 79, loved roasted asparagus at dinner while taking hydrochlorothiazide. Most mornings he felt woozy. We moved the dish to lunch and added half a glass of water. Within a week, the wobble faded and his afternoons felt steadier. Number 3, corn. Comforting and familiar, but it behaves more like starch than a vegetable after 60. Corn digests quickly, driving glucose spikes followed by crashes that trigger stress hormones and blood pressure swings, effects that are riskier at night. Research in the American Journal of Clinical Nutrition links high glycemic load foods to sharper post-meal glucose excursions, and summaries in stroke, AHA, associate glucose variability and nocturnal BP surges with greater cerebrovascular strain. Practical fix: limit frequency, skip corn at dinner, and when you do enjoy it, pair with protein or healthy fat, black beans, eggs, avocado, grilled fish to slow absorption. Choose whole forms, fresh corn on the cob, over flakes, puffs, or grits, which hit faster. Notice morning brain fog or headaches. That can be your cue to adjust timing. Diane, 74, loved a late bowl of cheesy grits. We swapped it for a lunch corn and bean salad with olive oil and chicken. Within a week, her 6 a.m. headaches and mid-morning crash eased, and her energy felt steady again. Number 4. Garlic. A beloved natural medicine, yet its anticoagulant effects can quietly stack with blood thinners and tip you toward bleeding, especially with concentrated supplements. Evidence in the American Journal of Clinical Nutrition and Reviews summarized in stroke note garlic's antiplatelet activity. Pharmacology papers echo interactions with warfarin-like drugs, which can destabilize clotting control. The fix isn't fear, it's dose and form. Keep to culinary amounts, skip capsules unless your clinician okays them, and flag garlic use before dental work or procedures. Watch for easy bruising, nosebleeds, new headaches, or unusual fatigue. Practical pairing. Enjoy sautéed garlic at lunch, folded into beans, greens, or fish. Big flavour, measured effect. Thomas, 81, added a 600 milliliter garlic capsule to help his heart, while on warfarin. 2 weeks later, he had frequent nosebleeds and a pounding morning headache. Under his cardiologist's guidance, he stopped the supplement, kept a modest garlic clove in cooking, and his labs and symptoms stabilized. Proof that smart form and timing let you keep the taste without courting risk. Number 5. Romaine lettuce. Crisp and light, yet its mild diuretic effect can quietly deepen overnight dehydration after 60. As thirst cues fade with age, a big romaine dinner can lower blood volume while you sleep, thickening blood and stressing fragile vessels, especially if you also take diuretics or BP meds. Reviews in the British Journal of Nutrition and AJCN describe age-related fluid regulation and hemoconcentration, while analyses cited in stroke, AHA, link nocturnal dehydration and morning events. The fix is simple. Move romaine to lunch, add a small glass of water with the meal, and consider a pinch of electrolytes if your clinician agrees. Pair with protein, salmon, eggs, chickpeas, to keep energy steady, and save heavier, water-pulling greens for earlier hours. Leon, 75, ate a big romaine and cucumber salad at 8 p.m. and woke foggy with a rubbery right hand. We shifted the salad to midday, added half a glass of water, and trimmed evening fluids to avoid sleep disruption. Within a week, his mornings were clear and steady. Same salad, better timing. Number 6. Onions. Familiar and heart-friendly, yet their key flavonoid quercetin can vasodilate. Helpful in moderation, but tricky when layered on BP medications or anticoagulants, especially late in the day. Reviews in the British Journal of Nutrition and Trials, summarized in the American Journal of Clinical Nutrition, note quercetin's blood pressure lowering effects. Add evening dehydration, and you can get pressure instability overnight. Work discussed in Stroke, AHA, links BP variability, particularly nocturnal dips and rebounds, to cerebrovascular stress in older adults. Practical approach. Use onions as flavor, not the main event. Prefer cooked, gentler hemodynamic effects, easier digestion. Keep larger portions at lunch, and if mornings bring dizziness, fog, or fatigue, reassess timing and dose with your clinician. Nora, 80, on amlodipine and apixaban, began topping her dinners with big bowls of raw onion and tomato. She woke lightheaded and drained. We shifted onions to midday, sautéed into soups and beans, and trimmed the portion. Within a week, her mornings steadied. Same flavor, safer timing, and form. Number 7. Raw carrots. Crunchy and guilt-free, but late-night carrots can behave like a sugar switch after 60. Raw carrots digest quickly, driving a post-meal glucose rise, then, hours later, an overshoot drop that triggers stress hormones, adrenaline, cortisol. That combo tightens vessels and spikes nocturnal blood pressure, a pattern linked to cerebrovascular strain in older adults. The American Journal of Clinical Nutrition has detailed how higher glycemic load choices amplify postprandial swings, and summaries in Stroke, AHA, associate glucose variability and nighttime BP surges with greater stroke risk. Practical fix: enjoy carrots earlier in the day and pair with protein or healthy fat. Hummus, a boiled egg, a few almonds to slow absorption and keep levels steady. Notice morning fog or headaches? Recheck your timing. Mr. Harris, 78, loved a 9 p.m. bowl of raw carrot sticks. To be good. He woke with headaches and shaky energy. We moved carrots to lunch with hummus and a handful of nuts. Within a week, his dawn headaches faded and his mornings felt steady again. Number 8. Broccoli. A superstar, but its vitamin K can throw off warfarin, vitamin K antagonists, if your intake swings wildly. The fix isn't to ban broccoli, it's to keep it steady. Studies in the American Journal of Clinical Nutrition and reviews in the British Journal of Nutrition show that consistent vitamin K intake stabilizes anticoagulation, while big week-to-week changes can send INR values bouncing. If you're on antiplatelets like clopidogrel or daily aspirin, vitamin K is less of a direct issue, but overall meal consistency still helps your care team predict effects. Practical approach. Choose a modest, repeatable portion. For example, 1/2 cup at lunch 3 to 4 days a week, and tell your clinician so dosing can align. Skip the broccoli binge after weeks without it. Rosa, 69, loved broccoli but ate it irregularly. None for a month, then huge bowls at dinner. Her INR swung low, then high. We set a steady lunch portion and logged it in her pillbox calendar. Her INR stabilized, her cardiologist smiled, and Rosa kept her favorite green, without the guesswork. Number 9. Celery light, crisp, clean. But after 60, it can be sneaky. Celery is naturally diuretic. Big raw bowls or frequent celery juice can pull fluid off quickly, and older kidneys plus muted thirst cues make overnight hemoconcentration more likely. Reviews in the British Journal of Nutrition and AJCN describe age-related fluid electrolyte shifts that thicken blood, while findings in hypertension link sodium variability to nighttime blood pressure swings. One more wrinkle. Celery salt in deli salads, canned soups, or seasoning blends can jack up sodium long after dinner, pushing BP higher while you sleep. Tips. Keep portions moderate, avoid large late-evening servings juices, choose fresh stalks over celery salt, and hydrate well, especially if you're on diuretics, BP meds. Ask your clinician about timing. Lillian, 77, juiced celery nightly for detox and woke lightheaded with jumpy AM BP. We shifted to a lunchtime snack, 2 stalks with hummus, cut the juice, and added half a glass of water. Within a week, her mornings steadied and home BP charts smoothed. Same veggie, smarter timing and form. Number 10. Tomatoes fresh and heart-friendly, yet in some adults over 60 the nightshade mix, histamine, tyramine and traces of solanine, plus acidity can spark BP swings, headaches, tingling, or brief stroke-mimic spells, especially after heavy evening portions. Reviews in the British Journal of Nutrition discuss nightshade biogenic amines and vascular reactivity, while work summarised in Stroke, AHA, notes how nocturnal BP variability and neurovascular sensitivity rise with age. AJCN highlights meal timing and composition as levers for post-meal hemodynamics. Practical fix: prefer daytime servings, cook tomatoes, gentler on the nervous system, boosts lycopene. Keep portions moderate and pair with magnesium-rich foods, pumpkin seeds, leafy greens, beans, to steady vascular tone. If you also eat peppers, eggplant, or take BP nerve meds, watch your body's signals. Etta, 73, loved a big bowl of tomato soup at 8 p.m. and woke with facial tingling and a pulsing temple. We shifted tomatoes to lunch, used simmered sauces over fish, and added a side of white beans for magnesium. Her fluttery episodes stopped within a week. Same flavour, smarter timing, and pairing. As we've seen, aging changes the way food interacts with our bodies. After 60, kidneys filter more slowly, blood vessels are more fragile, and thirst and insulin responses are less reliable. That's why the same vegetables that kept us strong at 40 can sometimes backfire at 70 if we don't adapt. The American Journal of Clinical Nutrition and the British Journal of Nutrition highlight how hydration, vitamin K consistency, and meal timing all shape vascular stability. And research in stroke, AHA, reminds us that blood pressure variability and nighttime glucose swings are among the strongest predictors of cerebrovascular events in older adults. The good news is, this is not about fear. It's about awareness and timing. By eating diuretic or high glycemic vegetables earlier in the day, keeping portions moderate, drinking even a small evening glass of water, and maintaining consistency if you're on blood thinners, you can continue to enjoy the foods you love safely. Most importantly, coordinate with your clinician. Your diet and your medications are a team effort. If this message resonated, share it with a friend who needs it. Hit like, drop a comment about which veggie tip surprised you most, and subscribe for more science-backed senior health strategies. Remember, small changes today can protect your memory, independence, and strength tomorrow.